Hey, and did you know I'm currently accepting new patients in New York, offering both in person and telehealth visits? And I also provide telehealth for patients in Michigan, with North Carolina coming soon. And I also offer coaching, both intimacy coaching and menopause coaching, nationally and internationally. So look us up on www.femvhealth.com. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf and this episode is everything you need to know about fibroids and what to do about them and how you can take care of them. Of course, before we get into it, a few things we want to make very clear is this not meant to be any type of medical advice. If you have any questions about your health or fibroids, please make sure you go see your healthcare provider. And of course, as always, this is not any advice on religions. If you have any questions about your religion, make sure you go speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast, because I just happen to be a Muslim woman that talks about sex. So I'm so excited to welcome onto the podcast again my friend and colleague, Dr. Cheruba Prabakar. Dr. Prabakar, for all those people that may not know who you are, if you could please introduce yourself to them.
Great. Thank you so much for having me. Hi, everybody. I'm Dr. Prabakar, and I'm an OBGYN and a minimally invasive surgeon. I practice out in the Bay Area in California, and my life's work is taking care of women with fibroids. I want them to live a life with reduced bleeding, pain, and improved fertility. So I'm so excited to be here talking about this topic in July, which is Fibroid Awareness Month.
Amazing. And we have something very special for the people listening and viewing this podcast is that Dr. Prabakar's new book is out this month. And at the time of this recording, she just got her book. Yes. So we'll be talking a lot about her book and what's in it and how you can also get a copy of her book. So Dr. Prabakar, so what inspired you to focus your career on fibroids? Tell me a little bit about the backstory.
Yeah, so now that I think about it in the process of writing this book, I witnessed fibroids up close and personal growing up. So as a young teen, 13, 14, I saw my mom suffering from fibroids. We were immigrants to this country when I was 12, and I remember having very heavy periods, clots, very anemic, tired, and she finally said to me, "Oh, yeah, my doctor wants me to have a hysterectomy, which is this major surgery." And we were, my sister and I were really young, 12 and 14. So it's not like she could share too many details with us, but it was a very scary time. She ended up going into the hospital with for a big up and down incision. She was in the hospital for many days. And I kind of like put that to the back burner for many, many years. Fast forward to Brooklyn, New York, where I did my fellowship after my OBGYN residency. And my fellowship, most of our cases were actually complex fibroids. Brooklyn was a very diverse place, women from all over the world, and lo and behold, just lots and lots of fibroids. And so it became just something I saw over and over again. After fellowship, I moved all the way across the country to the San Francisco Bay Area. My first job was in Oakland, where again, I saw many women with fibroids. And so it really fascinated me. Why do they form? Why does one woman have it and not another? Sometimes even without a family history. And then I just was really impacted by how severely it impacted people's lives. And so that just really drew me into this work. And there's still so much we don't know, but so I decided to kind of specialize in that.
Yeah. So I'm so glad you bring that up. We do a midlife women's retreat every year. And last year, one woman was there. She was talking about her fibroids and how she had a hysterectomy with her fibroids. And it was noted that she also had a vitamin D deficiency. What is the connection between vitamin D deficiency and fibroids? Or is there?
There is a connection. So, like many health conditions that women face, including endometriosis, vitamin D has actually shown to be a crucial link. We don't know the exact pathways as to why, but low vitamin D has been seen in many, many women with fibroids and endometriosis. So, in fact, there's a study at NYU that was done looking at kind of lifestyle modifications, dietary modifications, and vitamin D is one of those things that was recommended to get checked and supplemented if it was low. So, that's something I tell my patients all the time. So, absolutely, there is a link there.
So, so if they normalize their vitamin D, would it prevent fibroids or would it just decrease the size of the fibers they have? I mean, is it going to do anything to the fibers that they already have?
So I'm not sure that it's going to prevent fibroids. I don't think that's the case, but studies have shown that supplementing with vitamin D, green tea extract, and vitamin B12 together actually can shrink fibroids by up to 30 to 40%.
No
So
way.
it's yeah,
Right.
it's I know I was really blown away by that, and I tell all my patients now I actually check their levels and give them this advice for those who are really trying not to do surgery or just want to see, can they shrink it a little bit. But yeah, I don't think it's going to prevent them from forming them in the first place. But certainly symptom management can be helped.
That is so interesting. I had no
Yeah.
idea. That's great. So tell me about how you came to be known as the Fibroid Doc. So what does that title mean to you beyond maybe just being, a surgeon? Not just being a surgeon. I mean, minimally invasive surgery is very difficult. And
Yeah.
it's a tough fellowship and it's hard to get, by the way.
Yes, yes. I was very lucky to land that fellowship in New York, one of the best places to train. Really, the icing on the cake, really, for my training. Medicine can be so toxic, in terms of training, as you know, OBGYN residency specifically. So,
Yeah.
right.
OBGYNs are
So,
probably the most toxic people. At least
right.
one of the most toxic.
Right.
Yes, they
People are like,
are.
how come you're so nice? OBGYNs are typically really mean. I know. I was like, I know, I know. We definitely have that reputation. But yeah, my fellowship, in fact, I texted my fellowship director and I was like, that really was a highlight of my training. Such a wonderful program. And where I got to see a lot, again, New York being New York and, just seeing, a wide variety of cases. But, when I started to come on social media, I was like, well, what should my name be? I was like, do I just say Cheruba Prabakar MD? I'm like, oh, that's really complicated. People are going to mess up my last name. And then I was like, literally thinking about what to name myself. And I think fibroids were just so near and dear to my heart, in terms of I was just so fascinated by them. I was just so curious about, you know, everything about them. And I had crossed paths with so many women that I had taken care of with fibroids. And, we can talk about this later, but in my book, I share some of these stories that have just stuck with me and will always stick with me. And so I said, why don't I be the fibroid doc? So I looked through Instagram. There was nobody with that name. There's nobody with anything to do with fibroids. And then I looked on TikTok, and I was like, there's nobody with that name or anything to do with fibroids. So yeah, let me be the fibroid doc. And you know what? Here I am, 4 years later,
Yeah,
the fibroid
right.
doc.
All right, the Fibroid Doc. That's awesome. I love it. So, what is something you wish that every OBGYN understood about the lived experience of somebody that has fibroids?
So fibroids affect not just the woman, it really affects their entire family. It affects their dreams of maybe having a family. I think when we see patients in the office, many doctors are inundated. They've got 30 patients on their schedule. They've got 10 minutes with each patient. They are putting out fires like, oh, you're severely bleeding. Okay, here's a pill. You're severely anemic. Okay, here's some iron. Oh, you need surgery. Okay, go see this person. Right? It's just sort of, it almost becomes like a triage situation. And then when you want the patient to come back to you in a few weeks, well, they can't get an appointment because the next appointment is 6 months away. Right? So fibroids are, you just can't take care of a woman with fibroids in those 10 minutes. This is not like getting your pap smear done, right? So I wish more OBGYNs would just really sit with that and say, okay, if I'm not the person who's going to be able to take care of it, let me send this patient to someone who's really going to be able to spend the time. Or like, let me start with something and then have the patient come back in 6 weeks or 7 weeks rather than saying, okay, here's a pill, I'll see you next year. So I want everyone to know that this is a chronic disease. This is not like, okay, here's a pill and it goes away. This is a chronic disease, um, and it can also come back. So this is something that really needs to be managed over time through the reproductive years of a woman's life. So that's what I wish more doctors would understand about it.
Yeah, and I love the fact that you bring up that it is a chronic disease, right? Like it, and absolutely fibroids. Even if for those individuals that want to keep their uterus but want to remove those fibroids can grow back, and so it can
Yeah.
really be a problem. And I love the fact that you bring in that it can really impact their hopes and dreams of having a family, right? That's huge because
Yes.
there are
Yes.
so many people that have fibroids that are so large that they, even after having done that removal, let's say it was like this, I don't know, 20 centimeter size, fibroid on their poor little uterus, right? They take it out, you had to shell it out, all this stuff. And then you try to put that uterus back together. And all of a sudden you go inside the cavity of the uterus. Now they have to have a C-section if they have a baby, if they're even able to conceive again. Like it's a big deal, right? And
It's
so
a
it's
big
really,
deal.
yeah, yeah.
It's a
And
big deal. And if you get pregnant not knowing you have fibroids, I mean, I remember clearly in my residency, there was a patient who would come in every 3 weeks of her pregnancy, just clutching her belly, and she would be in so much pain, and everybody would be like, "Oh my gosh, she's going to deliver, set up a room," and they would set up everything, and she'd be like 0 centimeters. She was not in labor, but her fibroids were acting up, they were degenerating, and so she
yes.
was in so much pain, so it would send her into preterm contractions, every 3 weeks. And yet she was not in labor, and I remember like just breathing a sigh of relief when she actually delivered. So these stories never really leave you. But imagine her husband had to come every 3 weeks with her. Her other kids, they had to find childcare. Like, so it's not just, oh, I have fibroids. It really affects everybody in your life.
Yeah.
Yeah.
Yeah. And if you're like anemic, if you're bleeding out, I had a patient come into this clinic that I was working at. And it was in the Bronx. It was in the South Bronx. And I will tell you, she came in and she was bleeding through her clothes and she was anemic. And I could see like she was so pale. And, they took her vitals and her blood pressure was low. And she's like, "Do you think I need to go to the hospital?" I was like, "Yes, you may die." I'm like, "What the heck?" You know what I'm saying? Like I mean, visibly she looked anemic, right? And she's like, she was bleeding through her clothes. I mean, it was a mess. So, anyways, needless to say, I mean, fibroids are rough. And so, I applaud all those doctors that take care of women that have fibroids and the women that have those fibroids, trying to get care for them, right? It's really, really, it can really be a struggle. So, I'm
Yeah.
so glad that you wrote a book about it. So, congratulations again on your upcoming book. And so, you mentioned a little bit about what inspired you to write that book, about you taking care of it. But was there a chapter that was especially difficult for you or deeply personal to you while you were writing this book?
I wrote this book so that any woman with fibroids can pick it up and say, okay, here's everything I need to know, from beginning to end, right? Like, what are fibroids? What do I do? Where do I get help? How do I find a doctor? What are my treatment options? Like everything, all in one place instead of piecemealing your care. So that's really why I wrote this book. And in the process, the first couple of chapters really go into how so many women have been dismissed over time, and they thought that they were crazy, and they came into my office apologizing for complaining that they were bleeding, and that just sort of blew my mind. So I talked a lot about that, and I also talked about the cultural aspect. So fibroids affect 80% of women uh, by the time they're 50, but it affects 90% of women of color. So Black women and South Asian women. So I'm South Asian, I'm Indian. And so this hit me a lot. And I talk a lot about the culture of shame, the culture of suffering behind closed doors, and how that is often expected in some of these cultures. And, these are not issues you talked about in front of your family or other people. You didn't really seek help. You were often said, well, often told, well, deal with it, live with it. This is part of being a woman. And so I should really sit with those couple of chapters. The rest of it is fairly medical, but in the beginning, I really introduced these topics, and it really made me think like, wow, like depending on the family you're born, right, and how they approach medical issues, you can really determine, right, like what happens to you and your care.
I'm so glad you bring this up because this is, I mean, this is the Muslim Sex Podcast, right? And we know that there's so much shame and taboo around sex itself, regardless of whatever religion you are, whatever, ethnicity you are. But particularly in, South Asian communities, right? There's a lot of shame and taboo. And there's a lot of shame and taboo around like reproductive issues, bleeding, menstruation, right? Sometimes women don't go out. And then, when you were just talking, I was thinking about like, period poverty, right? Not having the supplies, not having pads, not having tampons, not being able to leave your house because you don't have anything, to help you while you're bleeding. Maybe these women, they live in the villages and so they're not able to get care. I mean, there's so much around that it really talks about, health disparities that we see in our country, not only in our country, but also globally that we witness and you and I know about because we're both South Asian and, being South Asian is a big part of our identity.
Yeah, 100%. I mean, and it's just so disruptive also to your life. You're right. Like, this stuff is not cheap, right? Like a box of tampons, a box of
Mhm.
pads, and you're changing that every hour,
Yeah.
multiple days a month. I mean, you need a whole closet supply, right?
Yes.
So,
Yeah. With
yeah, and these
fibroids,
products.
especially.
Totally, and these are not cheap at all. So there's that. There's the disruption of life, being ostracized really from events and things because you can't go to them. Certain religions. I'm thinking about some of my Hindu friends. I know they have very specific rules about like, well, if you're bleeding, you can't go to certain prayers and festivals and, in the temples and things like that. So, well, if you're bleeding 30 days a month, like you're going to be missing from all of that, right? So, yeah, so the repercussions are way more than just your body and your period. It causes ripple effects through your entire life and that of your family and community. So, um, just in the process of writing this book, like it just gave me a moment to sit back from clinical care and say, wow, this is really a big deal and there's no quick fix for it, right? So that's part of what makes it so hard.
Yeah, yeah. And, I didn't realize that 90% fibroids affect 90% women of color. So I didn't even know that statistic, but, that's a crazy statistic. I'm glad you bring that up.
Yeah, specifically Black women, but
Yeah.
second runner up is South Asian. Yeah.
Yeah. So if somebody's been recently diagnosed with fibroids, why do you think they should read your book before they make any type of treatment decisions?
Fibroids are confusing to many. They are afraid, like, oh, somebody told me I had a fibroid. It was probably never even explained. The next thing people do is Google. Then they, wonder if it's cancer, right? So there's all these questions that people have, and s- the information out there, you have to ask, is this legit? And it's hard to tell what's legit and what's not anymore. So they should read my book because I give you all that information right there. What to think about, what do you do next, do you have to do anything, what tests to ask for. So in your very short appointment with your healthcare provider, you're able to know what questions to ask so you can advocate for yourself and navigate the extremely complex healthcare system. um, and then if you are somebody who's done your research and you already know that, oh yeah, you know what, I'm trying to have a baby, I've got all these fibroids, I need surgery. Well, how do you find a surgeon? What questions do you ask? How do you prepare for surgery? I have all these checklists that go over what to do before, what to do after. So it's just kind of a comprehensive toolkit, I would
Yeah.
say.
I love that. I love that. So, at what point should someone seek out treatment instead of just normalizing their symptoms or saying that, this is just a bad period? It's just, something that I have to go through or suffer through. When do you think they should, seek treatment?
Yeah, I usually say if your periods are causing you to miss work, miss school, miss social events, and you are having to be on medications around the clock, then it's time to definitely seek care. Periods are not the most comfortable thing in life, and there's some cramping, there's some heavy bleeding, maybe the first couple of days, maybe you take an Advil, but if you're taking, 6 to 10 Advil a day and just laying in bed with a heating pad and have to cancel all your events, well, that's not normal. So at the sign of that, it's definitely time to seek help.
Yeah. And so, I think you mentioned this a little bit, but, do all fibroids need treatment, or can some fibroids, you just leave them alone? I guess if they're not causing any problems, you just leave them alone.
Yeah, that's a great question. Not all fibroids need treatment. Many women don't know they have fibroids until they're trying to get pregnant and they get a scan and it's like, oh, you have fibroids. Or they go in for a CAT scan or an MRI of something else and they get in the report, oh, you have fibroids. Patients never even knew they had fibroids. So not everybody will know they have fibroids. Not everybody will be bothered by them. And not everybody has to do something about them. But if they are causing pain, pressure, bleeding, fertility challenges, then yes, you should be doing something about them. And even if they're not bothering you, my biggest message is keep getting them checked out. Like every couple of years, get an ultrasound. Don't just say, "Oh yeah, somebody told me I had fibroids and it's not a big deal. It's 1 centimeter. I don't need to worry about it." And then fast forward 15 years when you're now trying to get pregnant, you know, it's
Yeah.
10 centimeters,
Yeah.
and you didn't know. So uh, yeah, just be aware.
Yeah. So, what are some of the biggest myths about fibroids that you hear from patients when they come and see you?
Um, Some believe that it's cancerous and
Mm.
it has to be removed. Some believe that hysterectomy is the only option because they read that somewhere or someone's told them that. Uh, Other women believe that because they have fibroids, they can't get pregnant anymore. So these are some of the myths that come in and that I spend a lot of time kind of demystifying and talking to patients about.
Yeah, I mean, that must be really scary, especially if they're thinking it's cancer. So that I'm sure that you probably
Mhm.
spend a lot of time going over that. So
Yes.
many women spend years, and I think you were talking a little bit about this, and you said that you kind of discuss this in your book as well. Is that so many women are being dismissed when they go to their provider and talk to them about this heavy bleeding, this pelvic pressure, perhaps pain with sex, and that there's heavy bleeding and debilitating pain. Why do you think that this continues to happen? Why do you think there's so much dismissal of women's symptoms?
I mean, we could do a whole different podcast on that, but for years, I think decades, women have not been included in research studies. Women have just been left out from really any of these development of medications and all of these things. And in general, it's like, okay, women can just suck it up. Like that's literally how I feel like many women are treated, and people, including in the healthcare system, feel like we can deal with a lot more than we should be. And so I think women are the fabric of society. We do all of the things that we do with and despite having fibroids and endometriosis. And so it's sort of a cycle that's just kind of been normalized. And then you layer in cultural, expectations, professional expectations. I mean, think about you and I in residency. If we were bleeding out every time you had a period, we'd probably be kicked out of residency because they'd be like, oh, you're not showing up 5 days a month. Like, that's not going to work out, right? So we've I mean, it's terrible, but that's sort of how society has been built, currently, at least in the United States. And so I think this has been going on for way too long. And now it's time to really speak up. And we've done this with things like menopause, but that's just the tip of the iceberg. I mean, there are so many other medical conditions, including fibroids and endometriosis, that really need to be a household name, that really need to be discussed and normalized and taken care of.
Yeah, absolutely. Do you think that, patients that end up having surgery, and I'm sure you counsel them about their different options for surgery. I guess it depends on how big that fibroid is. But have you noticed that women that have hysterectomies and you leave their ovaries intact, do they tend to go through menopause earlier?
Yeah, so studies have shown that yes, they can go through menopause up to a year earlier. Sometimes, because there's some shared blood supply to that's shared between the ovary and the uterus, I will see some kind of transient menopausal symptoms for a few months, where women will say that yeah, they have some hot flashes and sweats, but over a period of time that goes away. But yeah, on average, it is about a year earlier.
Yeah. So interesting.
Mhm.
And so when, surgery is the only best option, how do you counsel patients about that?
So the first thing I tell them is getting surgery for fibroids does not put you into menopause. So that's the number one fear of many women. Oh, if I do surgery, I'm going to go into menopause. So if you remove your fibroids, well, you're just removing your fibroids. If you remove your entire uterus, well, you're just having a hysterectomy. You're not taking out your ovaries. That is not, so it's not going to put you into menopause. That's the biggest thing I tell people, and then they're like much more relaxed and ready to, just take care of it. And then, of course, we go through all the details of how we're doing the surgery and what approach we're using. And then, depending on that, I counsel them in more detail.
And so, how important is it for a woman to seek, let's say, a second opinion before she decides to have surgery?
I think it's really important. I even say in my book, like, go see two or three doctors. Everyone's approach is a little bit different. Everyone may offer something a little bit different, and you may just vibe with different, doctors differently. So don't be afraid. No doctor should feel intimidated that you went to, get a second or a third opinion. I, in fact, encourage it, and I tell patients, come back if this is really what you want to do. But yeah, you should do that.
Yeah, and how do fibroids? I think we talked a little bit about this, right? But like fibroids can absolutely affect your fertility. But are there situations where they don't impact it much at all?
Yeah, for when it comes to fertility, if your fibroids are inside your uterine cavity, then yes, they need to be removed because that's actually where a baby forms as well. But some women have tiny fibroids that are on the outside of the uterus or on the muscle of the uterus, and they're not really going to impact fertility. The caveat though is that even a small fibroid can grow in pregnancy, and this is where it gets really tricky. It's rare, but it can grow to big sizes, creating problems like growth restriction for the baby or preterm labor. I talk about this case in my book, but there was a patient who went from like a 4 centimeter fibroid to a 23 centimeter fibroid in the first trimester of her pregnancy, and we had to operate on her during her pregnancy, which was no fun, but we had to do it. So there are cases like that. And so, you make the best decision, and you also don't want to go after every 1 centimeter fibroid because operating also has its risks, just by itself, but also for fertility. So it's a fine balance. So I spend my time really talking to my surgical patients about the pros and cons of each approach, and then we kind of come to a decision.
So fibroids definitely affect intimacy, and I'm sure you probably see that. And yet, our patients hardly ever bring it up. Why do you think that is?
I think even in the OBGYN's office, people hardly even bring up sex. I mean, don't you think? Like, I feel like I have to ask
Yeah.
that question
No, they never
specifically,
do.
right? They
Yeah.
never do. Um, like, are you having sex? Like, are you having problems, right? And if they can't bring it up at an OBGYN office, like, where are they going to talk about it, right? So I think it's just, again, GYN exams have become synonymous with breast exam and pap smear, right? Like people have a very hard time thinking beyond that. So when I ask a 50-year-old, "Hey, how come you haven't been to the GYN in 10 years?" Well, I already had my babies. Like, why do I need to see a GYN for? Right? Like so yeah, so I always ask about that. And yes, fibroids can definitely cause painful sex.
Yeah, I have. So it's funny when I ask about sex to my patients, because I mainly deal with like perimenopause, menopause, right? And so I'll ask patients, are you having sex? And they'll be like, oh no, I gave that up years ago, as if they're like giving up smoking or something. And I'll be like, oh, okay, well. Sure, that's fine. But, I have patients all the time, right? They don't bring up the sex component unless you bring it up. And that's oftentimes why they're not coming to you. They'll come to me more for like their hot flashes, their night sweats, their brain fog, their other things, right? But the sex is kind of like a secondary thing. However, I will tell you that a lot of the patients, about I'd say 50% of the patients that come and find me, their husbands are the ones that sent them to me
Mm.
because they stopped having sex. And
Mm-hmm.
that's become a problem in their relationship. And I just actually had a woman yesterday that came in and told me she hasn't had sex in 5 years. I've had somebody else come and tell me she hasn't had sex in 10 years. And, all for very different reasons, but also similar reasons. Whereas, like sex has become very painful, or they start to have vaginismus, or the dryness, or discomfort. It's always that sex somehow has become painful, and they just
Mm-hmm.
when they would go talk about it to their gynecologist would just be like, well, the one that I saw recently, she told me that her gynecologist said, well, it's just aging. You're just aging, so that's just what you have to do. And I'm like, what?
It's
What?
all part of aging. This
Yeah,
is,
yeah.
that line has to go away.
It's just awful. I was like, oh my God, how horrible. So, how do fibroids contribute to pain during sex, decreased desire, or maybe even relationship stress?
Yeah, I mean, relationship stress just from, the bleeding and the pain and the canceling plans, that's definitely going to cause relationship stress. I mean, I had a 30-year-old tell me she had to cancel her honeymoon and all like vacations with her
Oh,
husband, like all that stuff because she was bleeding out.
yeah,
But pain during sex because fibroids can grow in the lower part of the uterus, they can grow on the
yeah,
cervix, and so when you're having intercourse, you could be hitting up on those fibroids that can cause bleeding and definitely pain. So it's just a physical mechanism there.
yeah, yeah, definitely. And so much, right? Like we haven't even really talked about the pelvic pressure that people feel when the
Mm.
fibroids, especially if they're large, right? They feel like there's so much pressure there, and it's uncomfortable. And some certain positions during sex can be uncomfortable because of where the fibroids are, or if they're so big, it's hard for them to try different types of positions. And so, sex can definitely become more
Yes,
painful. And if they get really big, I'm sure that affects like body image. And we know that body image definitely, if you have a poor self body image, that's going to absolutely affect your intimacy and your relationship. So I'm
I
sure that
mean,
also, yeah.
yeah, definitely. And many women have said, "Oh, I thought I was just getting fat." When I do the exam, I'm like, "You've got this huge mass," and they're like, "What? Like, I thought I was just getting fat." I'm like, "Nope, you. Let's go get an ultrasound
Yeah,
because there's something going on there."
yeah, absolutely. So, what would you like partners to understand about someone who has to live with fibroids?
Yeah. So fibroids can not be an issue for some, but for many women, this really runs their lives and what they're able to do. So, in terms of taking care of family, household chores, keeping their own job, traveling, vacations, and so I would love for partners to just be more in one mind with treatment of fibroids. Go with your spouse, go with your partner to these appointments, provide support, be a team. And I love that you said, there were some men sending their wives to you. But I've got a patient just told me, oh, my dad was doing research and like found your name and, gave it to me. Or my husband was looking around for a good gynecologist and found your name. And so just participate in the care because women already feel so unseen when it comes to this.
Yeah, absolutely. So, you mentioned this a little bit in the beginning when we were talking about the percentages of women of color that end up with fibroids, but we know that Black women are definitely disproportionately affected by fibroids. What do we currently understand about these disparities?
I mean, there are a lot of disparities and reasons for it in the healthcare system in general. For fibroids, there were a lot of theories like, their chemical hair straighteners caused fibroids or the consumption of red meat. There are some links to these things, but we don't really clearly have understanding as to why Fibroids are so prevalent in Black women. Now, going back to the vitamin D connection, women of color, darker skinned women don't have a harder time maintaining a good vitamin D level just because of the amount of melanin and the conversion to active vitamin D. So, is that could there be a link there? We don't know yet, but there's active research going on there.
And how do you think systemic inequities affect diagnosis, treatment, and outcomes for women of color?
I mean, I write about this in my book, but for years, physicians were thought that Black women or Black people could tolerate pain more. And have you heard about this? Right?
Yeah.
Like, I was shocked when some of my colleagues told me they were literally taught that in medical school. My medical school did not teach me that. So I was blown away. But this is, I mean, it's 2026, and like people are still walking around believing this because that's what they were taught. Right. So, right then and there, when people come in with pain and bleeding, it's like they're not seen right away. They're not taken seriously. You're not rushed into a room in the emergency room. So you can see how this really starts to add up, right?
Yeah, I mean, like, well, we know the story of those three Black women, right, that were operated on by was it Dr. Sims,
Sims, yeah,
and without any type of anesthesia, thinking that they could tolerate pain. I can't even just the idea. I mean, when I get a paper cut, it is so painful. And I'm like sitting there like going, "Oh, I got this paper cut," right? Like, what the heck? And these poor women are getting hysterectomies without any type of anesthesia just because they think that they can tolerate. I mean, that blows my mind. I just can't even like imagine and think about like how horrific it must have been for these women, right? To undergo such horrible like surgeries on them without their consent, without anesthesia, and other people watching, all under
yeah,
like the assumption that it was for medicine. I mean, how
yeah,
disgusting.
horrible, horrible. And the fact that this stuff is still happening in 2026, I mean, not surgery without anesthesia, but I mean, the just like, oh, well, this can't be that painful, or giving people less opioids than they need, or whatever. There's so many things that are happening, but in general, women don't feel seen and validated, and Black women specifically. And so that's what I write about in the first two chapters about how women just don't feel like anyone's taking them seriously. I mean, I had a patient who came in and she said she was signed up for a surgery with another doctor, and she said nobody ever examined her. And I said, "Well,
Gosh.
you had a surgery date?" And she said, "Yes." Nobody even examined me because when I she came to me, I was like doing a pelvic exam, and she's like, "Whoa, what are you feeling?" I'm like, "A fibroids," and she's like, "Oh, nobody ever did an exam." I'm like, "What?
That's
Like,
so
who?
bizarre.
Like, how are you signing someone up for surgery without examining them?" Like,
Yeah.
it just, yeah,
That's crazy. That just blows my mind, right? Like, how do you take care of somebody without examining them? I have also, like, I've had patients come to me that, people come to me for, perimenopause, menopause. And so I have patients that obviously are going to telehealth providers, right? They only do telehealth, they don't do in person visits. So this woman for years was having all this painful sex and pain in her vulva. No one examined it. She went to her gynecologist who told her everything looked fine. It wasn't fine. She had lichen sclerosis. I was like, who is examining? She's like, yeah, I've been telling people, but like nobody, like you said, nobody's doing a proper exam. Nobody's looking. And so, she's going years and years without the adequate treatment. I mean, it's just ridiculous.
yeah. This is why
Uh,
it's important. I mean, telehealth companies and all that, they do provide. They close the gap for many women in many
yes.
areas, but it's not enough. Like, it's really, you need to be seen, you need to be examined, and have a physical, office too that you can go to.
So, what areas of fibroid research are you most excited about?
Yeah, I am most excited really about why they form. Like, what are the triggers? Because each there could be two sisters from the same family, and one has terrible fibroids, the other doesn't. I've
Wow.
seen patients who tell me, "Oh yeah, my mom had, my grandmother had, my aunt had fibroids. Now I have fibroids." I personally, I just told you my mom had a hysterectomy. I told you, oh, I didn't tell you, but I found out in the process of writing this book that my grandmother had a hysterectomy, my mom's mom. And I was
Wow.
like, oh, great. This means I'm definitely going to have fibroids. And I'm checking every year, no fibroids. But, like, well, how come, right? Like, it's weird. Like if it forms if it goes through the family history. So why is it, what makes some people more susceptible to it and not? And why in some people you remove the fibroid and they're good, never have a fibroid again. Other people, you remove their fibroids year after year, just keeps coming back, right? So these are some of the questions that I want to see answered in the research.
Yeah, and just following that train of thought. So, how do you think nutrition, exercise, stress, and mental health fit into just, I don't know, maybe your overall approach or maybe prevention? What would you say?
Yeah. Yeah, lifestyle is so big, and I think it's sort of poo-pooed in Western medicine, but all of the things you mentioned, diet, exercise, alcohol intake, mental health, sleep is so important. So when patients say, okay, well, what do I do to help my fibroids? I always start with lifestyle. Yes, everyone wants a quick fix, but sometimes good lifestyle changes can actually help shrink your fibroids. And I write about a patient in my book that happened to, and she actually didn't need surgery. And so always start with that and then move on to the other things. And as we know, lifestyle modifications can help not just fibroids or endometriosis, it can help so many other things in our lives. So we can actually prevent a lot of disease or prevent the progression of disease based on our lifestyle. And I see that all the time in my office.
And so many women, right? So I feel that my patients are so educated when they come to me, and they're always asking about like, what can I do to prevent this? What can I do? So they are thinking like that. So I'm glad you focus on that as
Mhm.
well. What's one myth about fibroids you wish would disappear forever?
I would say probably that it's like a one and done, like, oh yeah, I have fibroids. If I, get surgery, okay, I never have to like see a gynecologist again. No, like it could actually come back, and it could come back in a vengeance. Many more could come back. And so it kind of goes along with my general philosophy on women's health that it has to be ongoing care. It doesn't stop after, you had babies. It doesn't stop after you stop having sex. It doesn't stop when you hit 65, because that's when pap smears are no longer needed, right? Like it is an ongoing continuum because you find and discover other things that can be treated. So fibroids can really be a chronic disease, just like high blood pressure or cholesterol.
What I find so interesting is how sometimes when a patient has fibroids and they're in menopause, that the fibroids can be activated with the hormone replacement.
Mm, mm.
And so I'm wondering if you've seen that. And, what if it doesn't, what if their bleeding or spotting doesn't go away after, we know that with hormonal treatment in the first 6 months, it's normal they can have spotting. But what about if it doesn't get better? Let's say it's like 6 months or like even years down the line, and all of a sudden a patient starts bleeding that had fibroids that was never bleeding before.
Hmm. Yeah, so it really depends where the fibroid is. Like, so if it's, on the outside of the uterus or on the wall, it shouldn't really cause bleeding unless the size is now significantly going up. But if it's inside the cavity, then I would treat it just like a regular premenopausal patient and take it out. So I have seen when we start hormones, yeah, there can be some reactivation of some fibroids. But usually, in my experience, after a few months, it sort of peters away. But if it doesn't, then yeah, we would treat the patient just like a premenopausal patient.
That's so interesting because I do have a postmenopausal patient that is, she's only 45. Was she like 48 or something like that? But anyways, and she has fibroids and they're within the cavity of the uterus. And she's been on hormones for a while, but all of a sudden she started to bleed. So interesting.
Yeah.
Of course, you have to do a workup, make sure it's not endometrial
Yes. Do a
cancer, right?
biopsy.
Yeah,
Yes.
yeah, for
Hmm.
sure. And so tell me about, what's one mistake clinicians commonly make when counseling patients?
I would say many women are not given the full breadth of options because they usually come to me as a second opinion. And I'll ask them, like, okay, what do you know about, like, what was told to you about your fibroids? What options were given? And it was like, oh, birth control pills or hysterectomy, right? And that used to be the case, right? In my mom's day, yes, that was the case. But we have come a long way and we have so many more options now in terms of hormonal treatments that are more than just a birth control pill. So I would just love for clinicians to give patients that those options so they can, do something more than these two extremes because many women don't want to have a hysterectomy and they want to keep trying other options.
Well, that is good. I'm glad you give, women a lot of options. And so what's one piece of advice that you would give to a woman, let's say that's been suffering for years?
It's not too late to seek care. Get a second opinion, get a third opinion. This is why I encourage women to share their stories now, especially with the power of social media, because there are so many women out there who are suffering in silence. And, there's no need to suffer anymore. There are people out there who have specialized in this, people who want to take care of women with fibroids. So come and see us and, yeah, get the help you need.
I wish you were closer. I could send you all my fibroid patients.
Oh, I know.
So if a woman listening today feels exhausted, discouraged, or frightened after being diagnosed with fibroids, what would you want her to know?
You deserve more. It's not because of aging or because you're getting old that there are options out there, and you deserve a life that is free of bleeding and pain and fertility challenges, if that's what you're seeking. And those options do exist.
Nice. And if your book could change one thing about the future of women's healthcare, what would you hope that would be?
I think I would stick with the same theme of you have options because so many women feel defeated when they come to see me, when they come to see a physician for fibroid management. They automatically think, oh, yes, I must have a hysterectomy. There's no hope, And so I would love for women just to leave with hope and, just to go seek it. If you're not getting it from your current setup or whoever you're seeing, go seek it.
Well, we are done here. And before we go, though, for all those people that are listening, well, first of all, show us the cover of your book again, because I want
Yes.
everyone to see it. Yay, Fibroids Finally Heard. Amazing. I love it. I love the
Yes.
cover. I love the orange and the teal.
Yes,
That's
I wanted to
beautiful.
make it a little bold.
Ooh, and look at that picture of
Yes.
you. So nice.
Woo!
So for all those people listening and watching out there that are like, wow, she is amazing. I just love her. How can they get in touch with you? How can they follow you? And how can they make an appointment?
Yeah, great. So all of the information can be found on my website, thefibroiddoc.com. And you can pre-order my book there, get on the wait list. You can find the link to make an appointment. Follow me on Instagram at the Fibroid Doc, TikTok, YouTube. And if you are anywhere in California, I'm happy to see you as a patient, either in person or video visit. And if you're anywhere in the world and you just want to talk about your fibroid, your situation with it, you can make an appointment for a coaching call. So you won't be my patient, but I can still walk through this with you. And you can also find the link to my school community, SKOOL. So this is on my Instagram page. This is a community of women with fibroids from around the world. We do monthly challenges, we do monthly Q&As. So you can just get a little bit more information. It's been so fun talking to people from all over the country and the world because we may be in so many different places, but these problems are universal and we have so much in common. And so come join me there too.
Amazing. Well, we are done here. And thank you so much for coming on. And it's been real and really intimate. And remember, this is not meant to be any type of medical advice. So if you have any questions about your health or fibroids, make sure you go speak with your healthcare provider. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast, And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.